Welcome back. The diagnosis of celiac disease is on the rise. It is caused by a gluten intolerance, which is why maybe you're seeing a lot more gluten-free products in stores. So here to talk about celiac disease and whether going gluten-free is the answer is Hartford Hospital gastroenterologist Dr. Jeff Nestler, and also Amy Cianci, who says going gluten-free is the answer. That at least worked for you. So thanks for coming on the program. Doctor, why don't you tell us first what celiac disease is?
Celiac disease is an autoimmune disease where you are sensitive to gluten, which is the protein in certain grains like wheat, barley, and rye. And gluten triggers an immune response in your small intestine where the small intestine becomes injured and damaged, and you can no longer absorb certain nutrients.
What's the difference between celiac disease and, say, an intolerance of gluten?
Well, celiac disease is an intolerance, but there's gluten sensitivity, where individuals now are learning a lot more about it. Certain patients are just sensitive to gluten. They really do not have the disease, but they still feel miserable while eating gluten products.
Amy, what happened to you? You were feeling bad. You didn't know what was going on. You went to get diagnosed. Nobody could figure it out.
No. I was in my 30s, feeling very sick with a lot of GI symptoms, and I was diagnosed with other things for quite a few years, and then in my 40s I was just still noticing that there were still issues, and was talking to Dr. Nestler on the soccer field one day. Our daughters were playing soccer, and just saying I would eat a stack of crackers before I would go out shopping or something just to hold myself over, and I'd be so sick when I would be out, thinking, what is going on with me?
Right. And
then the stomach pains in the middle of the night. So he said, I want to test you for celiac. So sure enough.
You have it.
I have it.
So what do you do now?
I adhere to a gluten-free diet. It's a very strict gluten-free diet. Watch everything I eat, read the ingredients, and
how difficult is that?
It's very difficult. Salad dressing can have gluten in it. Ketchup can have gluten in it. Everything needs to be read very carefully.
Right. But you're doing all right now.
I feel great now.
What was it about that soccer field discussion that made you think maybe she's got this celiac disease?
Well, celiac disease there's many different symptoms, and most people actually asymptomatic and don't know it, but even a chronic stomach ache can be celiac disease. So she started describing her symptoms, and she had abdominal bloating and chronic stomach pain, and she went to multiple doctors, and I said, I bet you have celiac disease.
And she's telling you that she's eating a lot of these wheat thins or wheat crackers.
Exactly, and making it worse. And
you're like, aha.
Yes, exactly.
Is there any benefit to going gluten-free if you don't have this situation? Is it a healthier alternative lifestyle?
Well, it may be a healthier alternative. It depends what products you actually eat that are gluten-free. Certainly people who are gluten-sensitive should go gluten-free, and a lot of people just feel better. But you can actually gain weight by going gluten-free because it's processed foods, and you can actually increase your calorie intake. And also, gluten fills you up, and so you actually eat more on a gluten-free diet than on a gluten diet.
Interesting. Dr. Jeff Nestler, Amy Cianci, good to have the two of you on the program. Thanks so much.
Thanks for inviting us.
Appreciate that. All right.